In news for your health, computer components that go easy on your hands and wrists.
Here's Dr. Max Gomez.
Jim, Sue, it's been around for years, but now that all kinds of workers spend hours on a computer, doctors say they are seeing a dramatic increase in carpal tunnel syndrome, especially since most of them have never been told how to sit and type properly. The culprit may actually be your mouse. If you're like many office workers these days, you spend hours in front of a computer, dialing, typing, and mousing. Okay, using a mouse. And as a result, chances are either you or someone you know has ended up like this.
And it would go up my nerve over here.
Aria Mangual used to spend a lot of time at the computer, typing and clicking, until she developed carpal tunnel syndrome, also called repetitive motion injury.
My hands began to feel numb, and a lot of like electrical shocks.
The muscles that flex a wrist and move the fingers are actually up here in the forearm. They work kind of by remote control cables, the tendons that pass through the carpal tunnel. That's bone across the bottom and a ligament across the top right here. Now when those tendons get inflamed because of repetitive motion, they start to swell up. But because this is a tight tunnel, there's no place for the swelling to go, and that starts to compress the nerve that's also in the tunnel, the median nerve, and that's where the pain, the tingling, and the numbness comes from.
It's quite common to see pain only in the upper arm, or not to have pain at all, just to have numbness or weakness. The symptoms may not be only in the hand, may be spread all over the arm, or be just in the shoulder.
Dr. Gary Starkman is seeing more repetitive motion injuries due, at least in part, he says, to poorly designed mice and or their improper use. He recommends trying one of the new ergonomic mice, designed to fit the hand better. But everyone's hand is different, so click a few to see which works for you, or use a mouse pad with a wrist rest, or... One of the best ways to avoid developing carpal tunnel or some other repetitive motion injury is to take a break from your workstation every once in a while, maybe once an hour, and during that brief break, do a couple of exercises. You can clench your fists and spread your fingers, you can wave with your palms down, you can wave to yourself with your palms up, maybe even stretch a little bit. Do that about 10 times and go back to work. Now, if you do develop symptoms such as numbness, tingling, and pain, don't assume that it is in fact carpal tunnel. Other problems can have similar symptoms, so get a diagnosis from a doctor. And once you have repetitive motion pain, an ergonomic mouse won't necessarily cure it. You're better off preventing it in the first place with a good mouse, a soft pad, and some exercises. By the way, all kinds of workers can develop repetitive motion pain, not just computer workers.
All right, Dr. Max, thank you. We've got to go.